Our nation has been dealing with an opioid overdose crisis for many years. The National Institute on Drug Abuse defines opioids as a class of natural, semi-synthetic, and synthetic drugs. These include prescription medications used to treat pain and illegal drugs like heroin. Opioids are addictive and can be deadly when used by themselves or in combination with other drugs. Fentanyl and other synthetic opioids are among the major contributors to this crisis. In many cases, opioids such as fentanyl are mixed with other drugs without the user knowing, which drastically increases the risk of an overdose. The opioid crisis has been declared a public health emergency. Efforts to educate the public about the opioid crisis are expanding. On streaming apps, for instance, you can find a variety of programs about the nation's struggles with opioid addiction, the families and organizations with ties to the epidemic, and much more. Attorneys general throughout the U.S. are taking action on the opioid crisis. One way they're doing that is by suing opioid manufacturers, distributors, and other parties with ties to the epidemic, seeking to bring in funds that can help mitigate the destruction opioids have caused. Here in Beaufort County, we've seen the damage opioid addiction can inflict on families and communities as a whole. Tiffany Moore with the Beaufort County Health Department has been tasked with leading a variety of initiatives designed to identify and address opioid-related issues in our communities. Tiffany is here with us today. Thank you so much for being here today. I know you're busy and all kinds of stuff going on with task force.
Thank you for having me.
Tell me a little bit about your role with the health department, what kind of things you address on a daily basis.
So my job is several folds, I guess you would say, but my primary responsibilities are to act as the Executive Director of the Beaufort County 360 Board. I'm also the Behavioral Health Task Force Coordinator for the county. As a part of that, I oversee how the implementation process goes for the opioid settlement funds that Beaufort County received.
Cool. And how long have you been with the health department?
Right at 4 years.
Right at 4 years. Was this something you've always wanted to do or something you've always been interested in?
Yes, my background is in human services, so pretty much throughout my career I've dibbled and dabbled in different fields within human services, so it just kind of led me into substance use, helping individuals who have behavioral health problems as well. All of that just ties together, and once this job came about, it was just kind of, the perfect niche for me.
Mm-hmm. And you said, it's interesting you said that it all ties together, right? And that people who have substance abuse issues, there's so much that feeds into that, so many behaviors that feed into that or result from it. Is that really what you see, that
Yes.
It kind of compounds on everything?
Absolutely. When we speak with individuals who have that history of substance use, a lot of what we find out is they're using substances as a coping mechanism. Mm-hmm. They are using this to kind of remove themselves from difficult situations or to help them face these situations. A lot of times people don't want to go into them sober, so they use substances to just kind of pacify the situation rather than addressing it head on. But also a lot of other factors come into play. A lot of individuals who suffer with substance use disorders is generational in some cases. In other cases, they're using substances because it's a part of the culture. Mm-hmm. They're in a community where substance use is prevalent. So for them, they don't see it the way that we as outsiders who don't suffer from substance use disorder would look at it. But you also have to think about, in that same sense, social determinants of health. People who are growing up in impoverished situations, where people who suffer from food insecurity, from things like that. Again, a lot of what we're seeing with substance use is that people are using it as a way to cope with the situations that they're in, with the environments that they have to deal with every single solitary day. So there's a lot of different factors. And then in some cases you have co-occurring disorders. You may have an individual who is suffering from substance use disorder, but they also may have a mental illness that plays into it as well. A lot of different factors come into play when you start talking about substance use disorder and the causes of it.
And one thing I found interesting, when you talk about substance use disorders, is it's not always people who intend to abuse these substances who end up getting hooked. It could be as simple as going in for a major procedure. You get prescribed something, and then you find that you're having these withdrawals or something like that that make it really difficult to get off, and that's kind of how it stems for. I mean, do you see a lot of that as well?
Yes, absolutely. Kind of going back to the background for the opioid settlement and the way that it came about, a lot of individuals were going in for dental treatment for issues that they've broken a body part or some type of consistent pain that they're in, and they're prescribed this medication, and they're trusting their doctors to give them something that will relieve the pain, but not understanding the potential that it has for dependency. The opioid settlement came about because a lot of people started using Oxycontin. It was heavily prescribed at one point in time. People who were taking that for some type of illness or some type of chronic pain, once they stopped being prescribed the medications, turned to street drugs because that was very similar to the prescription that they had become dependent on. Really that chronic pain, the need for treatment kind of acted as a catalyst for the opioid epidemic. So again, a lot of people take medications every day, and we've always been taught, trust your doctors, trust that they have your best interest at heart. And in all honesty, they probably do, but I think going into before the opioid epidemic, a lot of doctors didn't even understand the potential for dependency and that withdrawal that comes after the prescriptions stop.
Yeah, so I think we've learned a lot, especially over recent years, as we've seen so much legal action, things like that, community awareness initiatives. We've seen a lot about the cause, the effects, and what we can do to help mitigate these issues. And you're involved directly in a lot of those initiatives in your position. One of those things I want to talk about is our Behavioral Health Task Force, which has a major role in all aspects of our response to the opioid epidemic. Can you tell me a little bit about what that task force is, who are the members, and what they do?
So the Behavioral Health Task Force is an extension of Beaufort County 360. The task force was commissioned to address issues within the county related to mental illness, substance use disorder. We, again, with behavioral health, we wanted to make sure that we were also addressing the substance use issues here. The task force has set out to try to be proactive about a lot of the issues that we're seeing in the county. Again, anything that falls under the realm of behavioral health, but because the substance use issues have become more prevalent, because mental illness, we're seeing those co-occurring disorders, we've been reactive to that as well. But we wanted to get a collaboration together that were community members, they were individuals with lived experience, our treatment providers and clinical professionals who work with individuals who have substance use and mental illness related issues as well. A part of the task force, just to give you an idea of some of the organizations involved, of course we have Beaufort County Health Department, we have the Sheriff's Office, Washington Police Department, ECU Health, treatment providers such as Agape, Passages, ClearPoint. Just about all of our providers in the community are on board with the task force in one way or the other, whether they're attending regular monthly meetings or if they're just a part of the community and action events that we do, or even, supporting just other smaller initiatives. It has become a county-wide initiative that we get involved in the community and handle it hands-on to address these issues.
In this committee, it's made up of people all throughout our county in a variety of different roles and disciplines who can really help spread that message and get things in action. Is that right?
Yes, absolutely. Key to not only the opioid settlement, but what we found out in addressing the issue of substance use, people with lived experience are your biggest experts. Not expert in the sense of a clinical expert, but they've walked the walk. They've gone through the withdrawals. They've gone through the struggles with dependency. The, in between, do I want to get treatment? Am I at that stage where I'm willing to receive help? They are experts in that sense, and they are very much involved with the task force. We have peer supports and individuals that are just regular community members who have loved ones who suffered through this, and they've been with them along the path. So they can lend to us what they feel like would have been valuable to their loved one or to themselves if it's someone with lived experience as they were going through this struggle.
Mm-hmm. I was listening to a podcast the other day with Jelly Roll, who's become very famous not just for his music, but for his role as an activist trying to put an end to the epidemic for educating people about that. And one of the things he said was when he was in a juvenile detention facility growing up, they would have various people come in and talk, but he said the problem was not a lot of them had those lived experiences. They were saying good stuff and they were good-natured, but they couldn't talk to you, directly as, having gone through that, knowing the issues, knowing the struggles that come with it. So you think that having those people with those lived experiences who can come in and say, hey, look, this isn't the way, this is what you should be doing. This is the slippery slope that you go down if you become addicted to opioids.
Yes, absolutely. Again, relatability plays a big factor in a person's willingness to internalize what you're saying to them. Again, while treatment providers, they of course have their own knowledge base and their own level of expertise. When you are actually trying to engage someone for the first time that's not at a table, they're not a part of a community collaboration that advocates for people with substance use issues or even mental illness issues, they're more likely to listen to someone that looks like them, that acts like them, that can say, hey, I was here at one point in time, but now I'm here doing this. Let me show you what my first steps were and help you to create a plan for you to get into treatment and recovery. That will go a lot further than anything I could say as the Behavioral Health Task Force Coordinator or even our clinicians. In a lot of cases, and I think I can speak honestly and say most treatment agencies here in Beaufort County have peer supports on hand, whether they're the ones that are hired through their agency or they're through the settlement or something like that, but they have them on hand to provide that backup support once they meet with the treatment provider. They can walk them through this process. They can connect them to resources in the community that, again, address issues that are not just a mental health or substance use issue, such as the social determinants of health, such as food insecurity, things like I can't get to where I want to be in life because I don't even have transportation to get to an appointment. They can get them to those appointments. They can, when they go through that process of, I made the appointment, but I don't want to show up because I'm just not sure today is the right day for me to take this step. They can kind of give them that little soft nudge they need to say, yeah, you got to take that first step. You'll be surprised. Look at me, 2 years clean. You can be the same in 2 years from now. They can look at them, and in some ways you would say they were role models for them or mentors to them. But that care navigation that they provide with individuals with lived experience, it works miracles. And we've seen it's an evidence-based strategy, so we know it works.
So those mentorship roles are so key, especially because, as you mentioned, a lot of people don't necessarily want to be pulled all the time, pulled toward what they have to do to get healthy. So it's so important to have those people say, hey, I know how you feel. And I know that there's a light at the end of the tunnel, right?
Absolutely.
So we talked a little bit about that task force, behavioral health task force, and all they've been able to accomplish, all they've been able to do working with the community. And to help that, in recent years, we've received a fair amount of opioid settlement funds. And that's kind of a nationwide thing right now, all kinds of attorneys general going after these companies that helped kind of propagate the epidemic, getting some funds back to help our communities recover. Can you tell me a little bit about what we've seen from those funds and what our task force is doing with those funds to help our community?
Yes. So one part of the opioid settlement is just kind of the way that it's set up. There are two options under the opioid settlement. All counties that signed the MOA agreed to abide by one or two options. Beaufort County decided that we would do the harder route, as most people say. So we're option B, which required collaborative strategic planning, which means you have to have a certain demographic of individuals present at the table during these planning sessions who provide input about how the settlement funds are used. So after we went around in 2021 and 2022 and got input from, again, many of our community partners, community stakeholders, the Behavioral Health Task Force led the efforts to provide strategic recommendations for the best uses of those funds. And just some of the things that we've been able to do with the funds that were provided to Beaufort County. Peer support specialists, again, having those individuals on hand to work with these people who are in the struggle. Those peer supports, we have two, both a male and a female, and the way that is set up. Every organization or agency in the county who works with people who use drugs has access to utilize the services of these peer support specialists. So they're not just in a silo working with one organization. They are in the community. They are there for anybody who needs them. Also, we wanted to focus on prevention. The age of first use is getting younger and younger and younger. We're hearing it, we're seeing it. A lot of the things that have come out since we've really been focusing on how opioids and drugs are getting in our community, a lot of our kids are getting them. They're young. So we have an opioid educator, as I call her. It's actually, I guess, the substance misuse prevention educator, but I call her an opioid educator. She goes into the schools as young as our middle schools, and she talks to them about the dangers of drugs. She talks to them about better ways to cope with situations that they're going through, peer pressure, bullying. We don't want you to turn to drugs because you don't know how to deal with those situations. What Narcan is, how do we use Narcan, why is it important, even if you yourself don't use drugs, to have it around you or in your home. Things like that. I just recently got an update from her, and she said the last group that she met with was really interested in Narcan, because what we found out, a lot of times we're talking to kids, hey, don't use opioids, don't use this, don't use that. They don't even understand really what you're talking about. So with our opioid educator, she can bring it down a level and communicate to them in plain terms that they understand. So that prevention piece, again, trying to get ahead of the problem at a younger age. So back in the day we had DARE, with DARE kind of collapsing the way that it did, even though it's revamping, but we needed somebody that could pretty much play that same role to make sure that our kids understand that there are true dangers out here. And with fentanyl being in the game, it is a game changer. Pills have become popular in recent years. Younger people are more prone to take pills, to use vapes that are tainted with other substances. So she's there to say, hey, you can go in the store and think you're picking up a vape and it's just nicotine, or if they're trying to get marijuana vapes, but it may not be that. It could have some other substance in it. It could be toxic to you. These pills, they're being pressed right now, If you take a pill, there is no guarantee you're taking what you thought you were taking, and you have a really big risk of overdosing from taking these substances. So now they know these perks that they're rapping about in these songs that they're hearing on social media, people are popularizing. They're understanding that when she goes in and says an opioid, she's referring to those. Like before, and I know her takeaways have been, they had no idea that that's exactly what she was talking about. So it was more she was talking at them. And a lot of times kids won't ask questions for clarification. Yeah. They just say, okay, well, the class is over, let's go. But she's there to say, hey, did you understand what I meant when I said this is falling into the category of opioids? Again, also in keeping with our interventions. So we use community projects, which is a small micro grant process to make sure that we are able to expand the capacity for the use of these funds throughout the county. Organizations who may be on the south side and aren't at the Behavioral Health Task Force table, who's not at BC 360, who doesn't come to commissioners' meetings, so that they're aware that there are funds out here that are available to anyone in Beaufort County working with people who use drugs or have an opioid use disorder. So what we've been able to do with that, a couple of things. We have been able to tackle issues of human trafficking. We know that a lot of times the individuals who are predators, they provide these young ladies, and some of them are very young, with substances because they want to form that dependency, so they stay dependent on them. So we've been able to tackle that intersection of human trafficking and substance use disorder, but also on our south side, we know we have less resources down there. We have people in the community who are trying to work on the drug problem there, but they don't have the resources or the funding to fully be impactful. Put some money down there for May's Outreach Center so that she can get out and get Narcan into the community, hygiene kits, to have these different group sessions with individuals who are still in that limbo phase of, I want help, but I'm not ready for help. We have worked with the Boys and Girls Club in Belhaven specifically, again, trying to reach outside of just the immediate city limits of Washington. Belhaven has more resources than, say, in Aurora, but not too many resources. So we wanted to make sure that our youth in Belhaven was getting the prevention piece as well. And then, too, an additional thing, harm reduction. So we've been able to expand our harm reduction efforts in the county as well. People who are active users who would need that Narcan to have it on hand, to push messages like, if you're going to use, don't use alone, but also clean supplies so that we can mitigate the consequences of IV drug users, different things like that. But again, a big way to get syringes out there that are clean, to get Narcan out there, wound care kits, different things like that. So we've done quite a bit with the opioid settlement, and all of this came about with the stakeholder engagement sessions that the Behavioral Health Task Force did. We did those around the county to make sure, again, that we're able to reach into every little pocket of this community.
And it doesn't take a whole lot of fentanyl to kill someone, right? I think people are surprised when they see, law enforcement agencies and others, they post, when they bust someone with these drugs, it's often like the size of basically a pebble,
yes,
a fentanyl rock that is enough to kill multiple people.
Yeah.
And I think that to me is especially jarring. And you talk about, these pills and you don't even know what's in it.
Right.
It could be a science project of sorts,
Exactly.
and all you need is a little sprinkle of that deadly drug.
Yeah.
And that's enough to kill several people.
It is. And then not only do you run the risk of having a pill that is laced with fentanyl, we also have carfentanil, which is 100 times stronger than fentanyl. So just think, of that little grain of salt-looking flake of fentanyl can do that much damage. Imagine what carfentanil could do to a child who takes one of those pills, and we don't know how much is in that pill. There's, again, getting it understanding that lots of risk. Again, fentanyl takes nothing for an overdose to occur or even an overdose death to occur. But then you've got stuff that's a lot stronger than fentanyl that's hitting our streets these days.
Yeah. It's a scary time for sure.
Very scary.
Are there like any trends or stats out there that show, you talk about, the concerns about youth getting a hold of this stuff. Are there trends in terms of, if someone grows up around it or they have parents or family members who have issues, if they're like more likely to have those issues themselves?
Absolutely. So going back to where I first mentioned that sometimes we found that a lot of times substance use is generational. Again, if you live in a household, and this is realistic, in Beaufort County, we have generations of people in one small household, and at least 3 out of 5 of those individuals has some type of substance use disorder. So just think, a little child who comes home every day, they're seeing the people that they respect, they love. These are the people that, these are their role models. They're sitting there getting high in front of them. They leave it out. Kid gets curious, and they go and want to experiment. And in some cases, you have these parents and these older individuals who will give it to children. So yes, we definitely see that, if you grow up in that situation and your circumstances are just substance use is running rampant around you, and it's just commonplace for people to use one drug or the other. They don't have to start with the highest level. They can start with, I see they're shooting up. Maybe that's not something that looks appealing to them, but if somebody walks up and offers them a joint, they're not thinking it's that serious of a thing because they see somebody high around them all the time. Their older brother, their older sisters are smoking marijuana, or they're taking pills, or they're eating gummies, or their mom and dad. Your dad's in here, he's drunk. And with some of these kids that we've interviewed to get success stories, we've heard these stories firsthand. Your dad is in here drunk, but your mom's in here high. And you're just sitting there hungry. In all likelihood, you're hungry. You don't know what to do. You don't have anywhere to go where you can trust someone to help you in your situation. A lot of kids just say, hey, let me get high too. And again, that's their way of coping because that's all they know. Your friends, everybody around you is doing the exact same thing. So yeah, it happens.
You hear that saying a lot, birds of a feather, they stay together, and that's really truly the case.
Yes.
With this kind of stuff. If you're around people who have those behaviors, you're likely to follow them as well. And it's, even more devastating when you find out, as you said, that many of these kids don't really have a choice. Like, where else am I going to go? And the people, my only role models, are demonstrating that absolute wrong behavior. It's just devastating. So I think it's great that y'all are getting out and not just reaching out to people who actively have these issues, but these kids who might be exposed to it growing up. Because you mentioned before, and especially in pop culture, you hear all these references to it, and people may not know what exactly is an opioid, because that's not just heroin or fentanyl. It could be a whole variety of things that could be exposed to you more often than you think. Right. Do you think what are some of the things that have worked in terms of educating people, not just about the effects, but this is what we're talking about when we talk about opioids? This is what you need to look for.
Yeah, being specific works. We're finding that out when we go out and we talk in the community, and you're going to get an array of questions, but instead of us just saying, hey, do you use opioids, or do you know somebody who uses opioids, we can say, do you have individuals that you know who use Xanax, who use Percocets, who maybe vape or use dabs, as the kids call them, I think. Actually saying what you're talking about and letting them know this is the danger that we're talking about. These Skittles parties that they're having, that Lord have mercy, I've heard way too much about. You can't, letting them know If you go into a party and they have a bowl full of different pills and they just tell you to pick one, you absolutely do not pick one. You probably need to leave. But you also need to tell them that somebody there needs to have Narcan on hand as well, and make sure that they're aware that it's going to probably be necessary in that scene. Just making sure that the messaging that we put out here is preventative. So again, we're addressing not only the people who are using drugs, but the people who are not using drugs. That we're getting messages out about the importance of carrying Narcan, even if you don't use drugs. You could be in the grocery store and someone could pass out and have an overdose in front of you. Messages about how to administer that Narcan. Because again, if you've got kids in a household and their parents are in here getting high, they could overdose, and those kids are sitting there while the parent is experiencing an overdose. They don't know what to do. Making sure these kids understand what to do. We hate to realistically think that kids would have to be a savior, but sometimes they are, and we've seen it before. We've even seen dogs overdose. Like, the situation is a lot more prevalent than people think. And again, just being prepared to act in the case of an emergency is one of the things that, and I'm going to gloat for a second, but we're seeing some of our numbers come down in Beaufort County since we've got these opioid settlement funds, since the task force has been actively out here putting this messaging out. And part of the reason, and this is just my suspicion, but I think because we're getting Narcan out in the community, we're making it more readily available. We know it's not really an inexpensive asset that we can have. So if people can go and get it for free through Prevention Point, or hopefully we'll get some Narcan vending machines soon, but getting it out into the community and letting people know, again, you don't have to be an active user to need this to have handy. Making sure that they know that our law enforcement has Narcan on hand. So when they respond to a call for an overdose, and that's, when I first took this job, that was an issue, making sure that first responders and law enforcement had it on hand. Trying to get co-responders to go out with our law enforcement. So while we don't have a post-overdose response team, in a sense, they're acting as a post-overdose response team to let them know once you get through this situation, there's help. It doesn't end here today. You can deny going to the ED on EMS, but, and that's why our numbers are going down, because a lot of them refuse to go once they get their reversal in the community. But having those resources and information available on the scene in the moment. If you can't give it to the person experiencing an overdose, give it to the family. They can be their connection to treatment. So again, our ED visits are going down, our overdose deaths rates are going down, our sheriff's office and police are not having to respond to as many calls for overdoses. They can actually tackle some of the real crime in the community. Our hospital can actually treat people who have physical ailments and pain, dealing with primary health rather than overdoses, because they're not equipped to deal with those. So a lot of times it's taking up spaces, taking up beds, that's putting a burden on those resources that we have in the community.
You talk about law enforcement, and the other aspect of that too is people who end up in jail for this thing. There's, particularly if you have a part in selling or distributing these drugs, those punishments are pretty harsh, and you can be charged even now with things like death by distribution, things of that nature. But you also get people who just end up kind of a frequent visitor to our local jails because of these addictions, because of these issues. So how important is it for us to also connect with those people who are kind of in those cycles of going in and out of the criminal justice system because of that?
One of the biggest assets that I think Beaufort County has that relates to individuals who have criminal justice involvement and substance use disorders, or just a history of substance distribution, or being entangled in that world, is our recovery court program. Again, trying to make sure that our resources are used appropriately. So the jails are not detox centers. They are not rehabilitation centers. But they have to act in that manner a lot of times because, again, you have this cycle of sell drugs, get caught with drugs, use drugs, commit a crime while you're on drugs, and you end up in one place. And that's our jail. With recovery court, they get a wraparound service. They get that detox. They get that treatment. They get, it's not a short program. So, yes, they're going to go in and they're not going to want to participate in this program. A lot of little resistance at first. But then when you put them with peer support specialists, when you give them a treatment schedule, support groups, they're around people who have the same issues that they're dealing with, and they're able to help each other through that process. It reduces our rate of recidivism. We start to see that because, again, they have that hands-on holistic approach to care. So they're not going back out here and selling drugs or taking drugs and getting caught in a car while they're high and getting sent right back to jail. Like, we have a process that they go through, and they're actually able to kind of slowly but surely get them to a place where we're not seeing this recidivism. We're not seeing this high level of incarceration, and 75% of the people sitting in jail are people who have some kind of drug-related crime. There are people there who are committing hardcore crimes out here in our community that need to be in there. So, yeah. Diversion programs, I'm an advocate of that as a whole, whether it's law enforcement assisted diversion, which is ahead of them getting that full charge for a crime, or if they've been charged and they're able to go to a recovery court of some sorts, or a family treatment court, because we have family treatment courts too, because, again, that home life is also a big issue as well. But yeah, we definitely have worked very hard to advocate for individuals who are criminal justice involved to receive treatment rather than punishment.
And to go back to the funds that are being used, the settlement funds and otherwise that are being used to combat this epidemic and help our communities recover, we're receiving millions of dollars, but it's not just, here's a check for $5 million. It's over, how many years is it now?
It's over 18 years.
18 years. So that's a long time spread it out. So is it important in the planning process to kind of adapt over time to our community's needs and kind of see, hey, where are our gaps now versus where they were 5-6 years ago?
Absolutely. Communities change continuously. We know that. Again, what our needs were in 2021 may be different from what our needs may be in 2027 when we created the initial strategic plan. So we want to make sure that we have the flexibility to be reactive to the actual community needs. Where we initially went in and we requested a certain amount of money to go to these community programs to pilot them, we found out there was a bigger need in the community. We went back and we asked to utilize a little bit more of that funding so that we could provide capacity for other organizations in the county who were doing the same work. The strategic plan that we're currently under was adopted in 2022. In 2026, we have a chance to go back in, do the same stakeholder engagement, community collaboration, make sure that we're listening to the community. We're looking at the numbers and the data around the overdoses and the overdose deaths to see if what we're doing needs to continue, but if we need to adapt new strategies, because Option B has a long list of strategies, well over 100. If we needed to pick up other things from those strategies that would be reflective of what is going on in the community at that time.
And, all the work that this task force does is very much visible and accessible to the communities as well. I mean, we've seen you present to the Board of Commissioners updates. You have annual meetings, things like that. What are some of those other ways that people can kind of keep track and maybe get involved with these efforts?
We have a BC Data 360 project that is just on the county website. It's under Beaufort County 360, and that gives you all of the data points from the scorecards and things that we use to collect our data and analyze it, so they can go in if you're just curious at any point in time, what is the county doing with these funds? And surprisingly enough, as much as I talk about it, a lot of people have no idea still. We have events that we not only put on, but we also have those that we participate in. So we're always promoting the Behavioral Health Task Force, inviting the community to come in and attend our meetings, so that they can be informed about what the task force is doing, but also stay updated about the opioid settlement. We have a podcast called Riverfront Talk Substance Matters, where a lot of the individuals who have been able to receive the benefits of our strategies, such as peer supports, recovery court, they're on there. They're talking about their journey. And what we do, the reason we do that is a part of our anti-stigma campaign. We found that stigma is a big barrier to treatment and to recovery, because, nobody really wants to talk about the dirty secrets that are happening every day in Beaufort County, where people are getting high and going and, overdosing and living in sad situations, dilapidated houses, and, just the different things that we come across in the community. So we have these individuals on that podcast. They can be an inspiration to others to talk about, hey, I used to get high and I use these drugs and I overdosed this many times and I went to treatment, and relapse is a real thing. But you got to stay the course, and this is what helped me to stay the course. Like things like that. But again, getting out in the community, we'll be out this afternoon at an event. We will have information for 988 for individuals who are in crisis situations. We will have Narcan on hand. We will have information about the harm reduction program that we have at the health department. Just a plethora of resources for individuals who are interested in finding out how to get involved and what we're doing as a task force.
I think that's important, that the recovery process, you talk about people who are hesitant about it, but they don't realize that it's hardly ever a smooth 100%, I'm just going to quit cold turkey and then it's going to all be fine. That these people kind of there's roadblocks, there's temptation along the way. That's probably just a big part of it, right? Is people need to realize it's not a perfect process. It's going to be tough, but when you get to the end of that tunnel, you'll realize it was all worth it, right?
Yes. We want them to know, if you relapse and you're doing your best, relapse occurs. It's not a one and done thing. You can't go to one treatment session and somebody's going to wave a magic wand and fix you. Like it's not. And we also want them to know, don't be discouraged or disappointed in yourself if relapse happens. We have heard people that will come forth and say, last weekend was a bad weekend for me. I had been clean for 6 months, but last weekend, people, places, and things, we preach it. I was in a location around a lot of people that I used to get high with, and guess what? I relapsed. I was weak. That's what they'll say a lot of times. I was weak. I relapsed. Well, guess what? You did the right thing. You took the first step to come in and speak your truth about what happened. You knew that wasn't the road that you wanted to go back down. So now let's move forward with trying to keep you on track to get the treatment that you need. And, a lot of, again, encouraging people. A lot of people will just, I did wrong. Oh my God, as a kid, you're like, oh my goodness, I did the wrong thing. And then you want to go ball up in a corner and hide. That doesn't help you if you truly want to get clean. So you have to be open to telling what happened and understanding what could prevent this from happening again. But just knowing that we're here to support you. We're not here to judge you, to look down on you, and we're going to work with you as long as you want us to work with you.
And I think talk about that recovery process. You talk about people say, hey, I was, around such and such. I was around these influences that always pushed me there. Do you see a lot of that recovery? Maybe the heaviest part of it is saying, hey, maybe I just can't hang around, these family members. Maybe I just have to abandon, these friends who I may have been close to for so long, but if I stay around them, it's just going to go downhill. Is that something you see a lot?
We commonly see that, and I'll be honest, we see it a lot of times among women. In their situations, they're living with someone. They both used to use drugs together. This person is in the process of getting treatment. This one is not. They're trying to go home every day after they leave group meetings, after they leave treatment, and they're walking into a household where people are sitting there actively getting high. And what we tell them is, and I know it's a struggle. It's not going to be, I'm just going to, because you said it, I'm going to get up and do it. But you have to consider who you're going home to and what they're doing, and if that is a threat to your sobriety. And if you're serious about your sobriety, you're going to have to think about people, places, and things. Remove yourself from this environment. You may have to end that relationship because it's detrimental to you and your sobriety. You have to make sure that you are around like-minded people. That's, again, why support groups work so well, because you have people there to encourage you. They may not have been clean any longer than you have, but you're going through the process yourself. You're not going to hang out with people who are doing absolutely what you don't want to do and what you've made up in your mind that you're going to stop doing. When you go over there to the support group, you may have 10 people. Every one of you all are giving each other pointers on, well, this is Labor Day weekend. Everybody around me is going to be turning up. They're going to be lit. You know how it goes. So in essence, they're going to be high. And this is where you go every year for Labor Day, and this is what you've done every year during this weekend. Well, guess what? Don't do it. Come over here to a Celebrate Recovery meeting with me. Right. That changes the whole trajectory of what may happen with your sobriety. Right. So yes, definitely people, places, and things. You got to make sure that you are protecting yourself. Doesn't mean I don't love you, doesn't mean that you're not valuable to me, but you're not good for me right now. And that's what we try to make sure that we let them know. Don't feel bad because you had to remove yourself from a situation. Think about what you want out of life and what path you're on right now. Is that good for you to stay in that situation? Right,
that it can be painful to change those scenarios in some ways, but it's probably not nearly as painful as you overdosing, as right. Family member overdosing or something like that, where you're actually losing life. So it seems there's a lot that goes into these efforts, right? It's not just a one-pronged thing. You have to attack it from all angles to help the community. What would you say makes it worth it for you? What is there something you see out there when you're doing this that makes you think, wow, like we're really making a difference? Or
I'm always excited when I look at our numbers, number one. But this is literally like a week into my 4 years of being here in this position. I have met people in 2021 that were nowhere near on their road to recovery. They were in the real life mix of substance use.
Right.
I have seen their entire path to recovery. So I can go and say, I saw this person. If it would have been 2021, they would have been standing out on the corner. They would have been unkept, not clean, probably under the influence. I can see this person working right now. They are going to work 5 days a week. They're staying sober. They have their kids back. Like things like that. Some of the individuals that I've seen are now peer support specialists. They're helping other people. They're doing re-entry. Wow. Like the stories and the people that I know, these are not stories to me. They are human beings that I have followed from 1 year to the next year. When I go out and I'm in the community and I'm talking about recovery and treatment and all the different resources, they're out there with me. That makes my heart healthy. Like when I go and I do a community in action event and I'm low on help and low on staff, and these very people that I saw walk into recovery court and they were under the influence and just not ready at that time, they're out there helping me. They're slinging hot dogs and sodas, and they're giving out cards to tell people what peer support is and what these treatment programs are. Like, that's amazing to watch. A full, I know people normally say 360, but a full 180. They flipped the coin.
Yeah. Wow. Isn't that incredible? Mm-hmm. They've been at their rock bottom. You've seen them at their rock bottom. Now you see them pulling other people out of rock bottom. Yes. And getting them to another level. That's special, isn't it?
Yeah. Being able to pay it forward. You know, we think about that monetarily, but they're paying it forward. And it's all about recovery. Mm-hmm. Like, this is a whole different meaning to pay it forward. You're pulling people into a space that they never thought that they could get in. Mm-hmm. And the only reason that they ever decided to take that step is because they remember you being out there on that corner looking a mess too. Yeah. But now they see you over here. You're advocating for Celebrate Recovery. You're advocating for treatment groups. You're saying, hey, buddy, let me get you some food and water because you don't look good. Yeah. First step, easy, simple step right there. Yeah. Then they can slide you a little card and say, hey, this is what I do, call me. Yeah, I love to see that. Yeah. I'm telling you, I love my peers. And even the ones that are not hired through the county, because, again, there are different people out here working, and they may not be associated with any particular agency, but they're doing the work. Mm-hmm.
And it speaks to the severity of the situation, too, that these people say, hey, I'm going to volunteer my time to help these people because I know what it's like then, right? And I know that they're in this pit that you just got to get out of, right? You know,
right. Somebody helped me, so I want to help someone else.
Right. Wow. Well, just a lot of just great things going on there, and it's not easy. It's not easy across any part of it. It's not easy in recovery. It's not easy in reaching out to people, right? So we do appreciate all you do. And what does the future hold, immediate future hold for these efforts now? Is there any events, meetings coming up, anything in the works?
So the Behavioral Health Task Force meets every third Tuesday of the month at Harvest Church from 10 to 12. So we have those meetings, and again, everyone is invited. Anyone who wants to participate can join us there. We will have our last Community in Action event for this year in Chocowinity, probably towards the end of October. We'll go out, we'll take our resources, we'll take the community with us. But then we will begin our stakeholder engagement sessions. So our 4-year strategic plan for the settlement dollars will be up in September 2026. To get ahead of that, we will start the collaborative process that we were doing before to get that community input, to look back and find out if what we did in the past has worked or if we need to add more efforts into what we're doing, to look at that long list of option B strategies and option A strategies, to find out if we need to adopt further strategies, and then we'll start to set a strategic plan to present to the Board of Commissioners in the early spring. So this will be highly publicized, hopefully also soon through the community project or the micro grants. We hope in the next month or two to be able to award our new grantees those funds. We had several different applicants this round, so we want to be able to announce those and make sure that they have funds from the settlement that can help them to get their programs off the ground or to maintain their programs. Mm-hmm. So that's hopefully the next step really soon.
Mm-hmm. And if someone listening to this either has a problem they want to address, opioid, maybe that they have an addiction, they have a family member who's addicted, a friend, what can they do? What would be those recommended next steps once they say, hey, I really want to find a resolution here?
I would advise them to, and we have 2 peer supports. Like I said, I would advise them to go ahead and reach out to a peer support specialist. That way they can find out how to get detox if they need detox, because that's going to be the first step if they're in active use. To recommend maybe treatment providers. If they need transportation getting to those appointments, the peers can get them there as well. You can reach out to me directly. I will refer you to resources in the community for treatment. I will refer you to the peer support specialist. If you have criminal justice involvement, I may reach out to the court coordinator and find out if you qualify for that program. Or just come to a behavioral health task force meeting. Again, there's a plethora of resources at that table. Everyone has some type of expertise around that subject. So when we come together, we can definitely make a difference, and we can get you the treatment and the care that you need and get you connected to whoever needs to be involved in that process.
Well, lots to look forward to there with the task force and with everything going on. And again, we appreciate everything y'all do, and for putting all these resources out there in the community. Is there anything, and I've taken up way too much of your time, but is there anything else you want to discuss that we haven't talked about already to close out about the task force or anything y'all are doing?
I would just like to say kind of keep your eyes open. There is a Beaufort County 360 Facebook page that we use to communicate a lot of the information, especially when we're having trainings and events that the community are invited to be involved in. Look there if you want to know what's going on with the data piece. Go to BC Data 360 on the Beaufort County site. All of the numbers and information is there. And then again, we're getting ready to start our stakeholder engagement sessions, and we want as many people in the community involved as possible, not just professionals, but regular everyday community members. So the flyers will start coming out for those in the next month or two. Make sure you participate in one of those events. They will be around the county, or come out to Community in Action and see all of the resources that we have available to help. And my pitch for Riverfront Talk Substance Matters, if you need a resource to kind of help you get to a place where you understand that you are not alone in this process, and you need to see like-minded people or people who've gone through similar situations, check out that podcast. Listen to them talk about how they were able to get through it. And again, if you just need someone to talk to, give me a call. 252-940-4239. I'm there, and again, I would love to put you in touch with someone who can help you along the process.
You gotta say the award-winning Riverfront Talks podcast.
That's right.
Award-winning.
Yes.
So yeah, great stuff there. Well, thanks so much for taking the time today, discussing this, and we look forward to seeing all the great things that continue to come out of the task force and out of all these efforts to really help our communities recover from these drug issues.
Yes.
All right, thank you so much.
Thank you.